I supervise the nurses, the home health aides, the social worker, chaplain, and our bereavement coordinator. Those team members make up our IU hospice team, and we make sure that we're meeting our patients' needs from a physical, spiritual, and emotional standpoint.
I'm the hospice social worker, so I go into homes and I help the family with resources as far as respite, transportation, in-home caregiver agency for caregiver burden, and also just provide support and companionship to anybody that just needs a listening ear.
I take in referrals. I see all the referrals that come in, hospital side and then outpatient side. We do GIP in the hospital, so those are for the patients that are usually actively dying and their symptoms aren't manageable outside of the hospital. And so it's very critical that we get them onto service right away. A lot of times they pass, within a few hours after coming onto service. Once we get them comfortable, then their body just, is able to rest peacefully. And then we've had patients on service, over 2 years. If they are declining, slowly at a time, we can show that they are still hospice appropriate. They still have that hospice diagnosis and they still qualify, but we've helped them live a little bit longer.
Oftentimes people, think of hospice and they think of those last few days, right, before somebody passes away, and that can be a sad time, and it's a time of grief and mourning. But hospice is more than that. The requirements for hospice is just that you have a terminal illness. We have patients that are still active in the community. Sometimes our patients are still employed. And we provide that care to them throughout that process, throughout that transition, so that it's a smooth transition for them, as they go from that more active state to the less active state, and then eventually passing away.
I like to get hospice in there as soon as possible because, hospice is just as much for the patient as it is the family and the caregivers and the friends. And specifically for my role, I go in and my focus kind of tends to be on the patient, but then as the patient progresses and declines, my focus kind of shifts to the family and the caregivers to make sure that they have what they need and that they're doing okay. They're the captain of the ship, and if they go down, the ship goes down. And so we need to make sure that they're supported and have what they need.
I enjoy all of the wonderful cards that we get from our family members, and sometimes our team has even been mentioned in obituaries, and I think that's such a testament to what we do and the care that we provide, that we can make such an impact.
We as a team kind of wrap our arms around these families, and like I said, it's some of the most difficult parts of our lives that I kind of get a front row seat of helping them and hold their hand as they go through it. And I've been blessed with two very, very special patients that, they asked for me to hold their hand in their last moments. And I will never forget that.
It's one thing to be there when your child is born and they take that first breath, and it's very surreal that, that life is right there. But it's also very surreal when they take their last breath and you see that and you're a part of that, and that family connection and the dynamics, it's